Hello, and welcome to this edition of Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today we're going to discuss one of my very favorite subjects, perhaps my very favorite subject, and that is the many and varied health benefits of exercise. And not only are we going to discuss why you should exercise, we are also going to discuss how you should do it, and that is how you, the viewer or listener, can start your own exercise program at home, or if you're already doing one, how you can improve upon your own exercise program to look better, to feel better, and to get healthier. To this end, I have the great pleasure of welcoming my friend and colleague, Dr. Matt Gammon. Not only is Matt a board-certified sports medicine physician, he's also a former college athlete, having played soccer at UVM, go Catamounts, and he's an avid and daily exerciser as well. Matt, thank you very much for coming and welcome to the program.
Yeah, thanks for having me.
So I thought we'd start off by asking Dr. Gammon the difference between activity and exercise.
Well, I think it's an important differentiation for our patients, because I'm sure you do. We have lots of people that come in and say, well, I'm very active during the day. Why do I need to exercise more? Activity such as walking, just doing daily activities around the house, those sort of things are important. And the more active we are, the more it's helpful to our overall health. But that's different than having a very specific time where we exercise to the point where we're raising our heart rate to get other health benefits from exercise.
So a lot of my patients, Matt, are very, kind of cancer phobic kind of thing, including myself. And I just wanted to take a minute here to talk about, the effect of exercise and cancer. Prevention, treatment, could you give us a couple minutes there?
Yeah, so like many things, we don't understand all the factors that go into, it's obviously why certain people develop cancer, but there's a fairly large amount of research that shows that if you exercise, particularly moderately, most days of the week, and we can talk about what that means a little bit more, that many types of cancers, you lower the risk of that. Now, some of that may have to do with other health factors as well that go along with exercise, but clearly there's some benefit in that. There's also benefit in people that actually already are being treated for cancer or have cancer in terms of both health, overall health, survival rates, and just general wellness and how they feel about their things when they're going through their treatment. So, if somebody is saying, what's the best thing I can do to prevent cancer? Well, it depends on the individual cancer a little bit. But if somebody's just globally saying, hey, I don't have a specific risk, in my family or specific genetic risk, by far, exercise is the best thing they can do.
That's a really good point, because I have a lot of my patients, they're cancer phobic and they don't want to develop cancer. And what I like to tell them is, listen, rather than just sit around and worry about it, go out and do something. And it's great that we have, have this evidence that exercise can prevent cancer as well. Tell us about some of the other health benefits of exercise.
Well, again, when we're talking about specifically exercise, we know, again, if you're active, and the more active you are, the lower your overall risk is of having things like strokes and heart attacks. But if you take that activity to the next level, and what's the next level? Well, the next level is at least moderate.
Okay. So what's moderate exercise?
So moderate exercise, the way I describe it to people is you have to feel a little uncomfortable while you're doing the exercise. Nice. And there's different scales that people use, but if you put it in heart rate terms, you're looking at sort of 60 to 70% of what we would call maximal heart rate, which is an age-dependent thing with some genetics involved. But in simplest terms, it's, I'm dedicating myself that even if I'm walking brisk enough where it's a little uncomfortable for me. I know my heart rate's up. I may be sweating a little bit based on the time of year or what I'm doing. If you exercise at that level, there are lots and lots of things that happen in your body. There's hormones that get released, there's chemicals that get released that do a whole host of things that stabilize membranes, they act in the repair process. One of the things reasons they think it may help cancer, right? We know a lot of cancer treatments now are, we use the immune system to target cancer, and so exercise actually helps boost the immune system. So that may be why exercise helps prevent some of these things. And so you're talking about very specifically almost every condition you can think about. Exercise has a benefit. The only very few that I can think about, people with migraines that are actively having migraines, exercise is not generally helpful because it makes the migraine worse. But people with migraines that exercise on a regular basis tend to have less migraines. People with high blood pressure, obviously diabetes, mental health issues, depression, anxiety, all get better with those sort of things. Again, I'm sleep. That's an important one I tell people when they say, listen, I'm not sleeping well, and we know how important sleep is in terms of basically our overall health, cleansing the brain. That sleep gets better if you're getting exercise during the day.
One of the things I like to tell my patients is, if you want, they come in, they just don't feel good.
Yeah.
And they're like, Doc, I want to feel better. A lot of them are asking me for some kind of vitamin or energy pill or some type of remedy. And I'm like, I got a remedy for you. And that remedy is exercise. If there's one thing that I've noticed that exercise does for me is it just gives this perception of well-being boost. You go out and exercise, you're in a better mood, you perceive yourself to be healthier because you are healthier.
Yeah. I think that's a misnomer. I mean, I think we don't do a good job sometimes. I know I don't when I talk to people about exercise. Is really describing it. This is a therapeutic intervention for your health.
Right.
This isn't just me saying, "Hey, go exercise."
Go
and
exercise.
That there are chemical things that happen to your body when we use appropriate therapeutic exercise. Now, sometimes in my world in orthopedics, sometimes that therapeutic exercise is like a strength training exercise because I'm having a problem with a certain body part, and we need to actually get that body part. We're either working better or stronger. Or if we're just talking about, hey, somebody's got a little bit of high blood pressure, and like my case, I have a little bit of high cholesterol. I know that if I exercise at the right therapeutic level, that's better than me taking medicine for my cholesterol.
Well, that's great to hear. So let's talk about just the average individual who just wants to look better and to feel better. We were talking earlier about what motivates people to exercise. And what motivates people to exercise is probably what motivates them to do really anything, and that is that they want to look better and they want to feel better. I think the health outcome things we're more focused on those. So your average guy or gal that wants to go out and exercise, what do you recommend?
Well, I think a couple things to start. What I always tell people is, again, we want to get to the root, why we want to exercise, what's the point? And because you and I were talking a little bit earlier too, exercise is not great for large weight loss. Right. When it's by itself.
By itself.
Right. And
Without
any changes. And what I always tell people when we talked about this before too is that it's really hard to out-exercise bad eating habits. Right.
Yeah.
Now you could.
But I've been trying to do that my whole life.
Yeah,
come on now.
Me too. But you could, in theory, I think, exercise enough throughout the day. And there are certainly people that burn 10,000 calories a day.
If you're training for a triathlon or running a marathon.
Then you can do that. But in general, I want to make sure, because I think people get frustrated if they say, well, look, I want to exercise to lose weight, and then they go through 2 or 3 weeks or 4 weeks, and maybe they haven't lost any weight.
Right.
Or they've only lost a little bit of weight.
Right.
So I think that's an important thing to help people understand. Well, listen, in the beginning, this is really good at helping you maintain weight at a minimum. It will help you lose some weight, but it has to be combined with diet to lose more weight. But in the beginning of exercise, and this happens to me when I've had a break, your body doesn't realize you have extra calories stored. All it sees is what does I burn today. So sometimes you get hungrier when you start exercising.
Absolutely.
Right? And so your drive to eat a little bit is more, and that'll go away. Your body will balance that out as you get used to the exercise. So what I really tell people is let's make sure we understand why we're exercising. And for me, I think, I exercise mostly for my kids. I mean, I want to feel better, but I have 2 young kids, and I know that I want to be as healthy as I can be as long as I can be, right? So I know that if I exercise and even do a little bit of strength training, that's going to keep me as active as I can be for as long as I can, be, or at least gives me the best chance. The second thing I tell people is this is not something that has to take up your whole day. It's not something that has to make you feel miserable, but you have to find something that you get some enjoyment out of.
Right.
Something that, or at least something that you can sort of build into your schedule.
Right.
I don't enjoy riding the exercise bike at lunch.
Something you can tolerate.
But I can tolerate riding the exercise bike at lunch.
Right.
Enough. And then in combination, you have to find something where I'm comfortable enough pushing myself to that level. So some people, they might have a bad knee. They maybe can't walk fast enough to get their heart rate up enough, but they could get in a pool and do it, or they could get on the exercise bike and their knee may tolerate that. And I think, again, the other thing is, it's like everything. How do we build a habit? You build it slowly, and you're going to fail sometimes. And when you fail, it doesn't mean you should stop. So if you miss a few weeks of working out, it doesn't mean you shouldn't go
get right back on the wagon.
Yeah. But, brisk walking is fine. As long as you're walking fast enough. I mean, you don't need special equipment. You don't need those, any of those sort of things. We have a lot of hills around here.
Yeah.
So walking here sometimes can be quite challenging.
In my practice, I tell people walk. Yeah. It doesn't require a gym membership. Yeah. You've already got a pair of shoes, and you can do it 365 days a year, even in Vermont.
Yeah.
My buddy and I, this was a number of years ago, but we set out to walk or run every single day for a year, and we woke up at 5 o'clock in the morning and did it. And I got to be honest with you, there were some mornings it was pretty painful.
Yeah.
But we did it, and I think a lot of people run out and buy a gym membership. And I'm great for that if you're going to use it.
Yeah.
But so often, people then don't, or it's money they can't afford, that kind of thing.
Or just to motivate. Look, we all, gym memberships go up in January, right? Everybody makes their, the gyms are packed for a few months and then it drops off.
Yeah.
I think part of it is trying to experiment and find what works. Like my wife started working out a lot more in the last couple of years, and she really likes the group-based environment.
Right.
So she goes to the gym, but it's really she goes to classes, and she really gets that
The
really motivates her. The camaraderie,
the fellowship.
I'm the exact opposite. I like to suffer by myself.
Right.
I don't like to suffer. I'd rather just take the dogs and go suffer for a half an hour. And I say suffer jokingly, but I mean in all seriousness, that little bit learning that how to feel uncomfortable while you're exercising is important. Again, you don't have to feel miserable, but you have to feel
because if you're totally comfortable,
then you're not working hard enough.
Then you're not working hard enough.
You're not working hard enough. You get some health benefit, right, from just being active and walking at low levels. But if you're not uncomfortable, your body's not stimulating all those hormonal things and all those chemicals that you need to really get the maximum benefit from the exercise.
Right. So if you're on a flat walk, add some elevation.
Yep.
It's amazing to me how much elevation will increase your workload.
Oh, absolutely. I mean, exactly. And again, I think the thing is really finding, if you're having trouble finding something because you're having problems, well, then that's what we're here for, right?
Right.
That's what you're there for, so that we can try to problem solve with you, either fix the problem that you have that's keeping you from being able to do what you want to do, or try to work on, hey, maybe there's some alternative things that we can do to get your heart rate up. The other nice thing with exercise is it doesn't have to, we say 30 minutes, and everybody's a little different, and probably closer to 60 is better overall, right? But but at least 30 minutes. That's sort of the mark. But you can do 3 10-minute sessions. Right. So if somebody goes up and down their stairs,
so they're additive.
Yeah. If somebody goes up and down their stairs for 10 minutes, 3 times a day, at a pace that's enough that their heart rate's up, that seems to be just as good as actually having some dedicated time at the gym.
Right. So one of the things that I love about being a family doctor is I oftentimes learn stuff from my patients. And I saw this guy come in one time, and he looked great. And his blood pressure was down, his weight was way down, he looked fantastic, he was happier, he was more animated. And he had been doing this exercise program at home with old-fashioned calisthenics, including planking.
Yep.
So he was, some of these things I think we tend to forget about. I grew up, Jack LaLanne, remember Jack LaLanne?
Of course, yeah.
Who lived to be like, who was an exercise guru until he was in his late 80s.
Yep.
And lived a long time. But anyway, so some of these things we can just do at home, that are strength training based. I like to use this as a segue to talk about weightlifting. You hear different things about weightlifting, and whether that's a good idea for you. I personally think that it is, but I'd love to hear your opinion on that.
Well, certainly strength training is important. We know that we all, after about the age of 35, start to decline in strength, and we want to fight that off as much as we can. And the reason you want to fight it off is not because, we still feel pretty good in our 30s, and most of us in our 40s. By the time we get into our 50s and 60s, if we haven't tried to maintain, it's hard, and we really start to lose power. Now, the nice thing is that even in our 50s and 60s, we can get stronger. And I would say strength training rather than weightlifting, because it doesn't necessarily have to involve weights.
Right.
It certainly can. It has to involve some resistance, right?
And that could be your own body.
That can be your own body. That's exactly right.
Yeah.
So strength training is a super important component, and it can be combined with the exercise in the sense that you can do circuits with weights or body weights that get your heart rate up enough where you're getting both strength training and you're getting the cardiovascular benefit from it.
Yeah.
That's the approach that I generally try to take, mostly, again, trying to find the time to do both. Often doesn't fit my schedule very well. Or maybe I'm just too lazy. I don't know, but but at least it's
all about priorities.
Yeah, and for me too. Like if every third day I kind of do a circuit thing for half an hour rather than ride the bike or on the treadmill, it's just a little change it changes it up a little bit, so I don't feel so.
Right, because variety is the spice of life.
Yeah, for me anyways. And but again, some people are different. Like we have a friend who likes to run. He runs almost every day.
And he knows who he is.
That's right, and that's fine, and that's great, if that's your thing. But I think that's where that comes into the experimentation for people is, how do I find something that works for me? But I certainly would encourage everybody that's, again, you don't have to lift heavy weights. As a matter of fact, even at the professional level, we've gone away from lots and lots of heavy lifting. Both because we know it may cause more damage to certain joints and certain things, particularly in our professional players, but also because you don't need to. I mean, you can get really, really strong by doing what we call more functional exercises,
like
lunges, squat, single leg squats,
Right.
Those sort of things. You know, I mean, some people can't do pull-ups and those sort of things, but there's lots of ways you can do assisted. You know, you can do a push-up against a wall to start.
Right.
You know, I tell people, look, that's resistance, and then you can lower down to a table. You know, and then you can go down to the floor, and you can, you know, there's ways to modify all that stuff. And I think the one thing I would say with strength training is that's where people that have experience with weightlifting, if you're interested in that, it's not a bad idea to meet with somebody a few times so you get a sense of, hey, this is really how I should be performing these exercises versus just kind of trying to do it on your own.
Right. So while we're at it, how do you feel about supplements and things like that people use to kind of help them exercise or get them healthier?
I mean, most of them don't work. I think that's the most important thing. Now you can argue there are a few like creatinine and creatine. Sorry, can sometimes, you know, short burst power that can actually. So if I want to bench a little bit more, and that's my goal, but in general they don't work. I mean, particularly in the United States, almost all of us are getting all the micronutrients we need. From
absolutely
things.
Right.
Vitamin D may be the only one I would argue that, you know, some people don't, you know, whether they're in the sunlight or not, or particularly in Vermont in the winter. You know, there are some people that probably need some more vitamin D, and that's very important for bone strength and tendon strength and muscles. I think one of the dangers is, and we know this from tests, is that if you go into any of the stores with all the sports supplements, particularly the ones that are kind of mixed together in powders and things, 90+% of the time, there's stuff in there that they don't say, or it's in there in different amounts that it belongs. And some of that stuff's really dangerous.
Right.
Some of the stuff's really, really dangerous. They are variations of all these, what they call SARMs, which are basically hormonal variants that can affect people that they don't know. So it's basically like taking testosterone, but you don't know you're taking testosterone. There are sometimes they find testosterone in some of these things or some of these supplements. I mean, it's, you know, it's, so you really want to be careful. You know, protein shakes and protein and those sort of things. Again, most people get enough protein. It's not a big thing. I don't mind if somebody says, hey, as a snack, I use a protein shake or those sort of things. You know, for most of us, if we're not power lifters, you know, and we're not competing in the NFL and we don't, you know, we just don't need that extra load. And mostly even at the big level, those guys like world's strongest man guys, I mean, huge guys, they just need calories. That's why they use protein, because it's just, they can drink a shake and it's just easier than trying to eat more food.
Right. So, we've talked about, you know, kind of how the average guy wants to develop a health program. What about now somebody with some issues?
Right.
For instance, somebody with orthopedic issues.
Yep.
You know, what can we do to help a person who's got possibly a chronic health issue or you know, even a temporary health issue to kind of get them exercising and get better?
So I think I'd split into two things. So you've got sort of the orthopedic issues that may limit somebody's ability to do things, and then you've got people that just have chronic health conditions, right? So there is no testing that's required for somebody to do moderate exercise. You don't need a stress test, you don't need an EKG, there is nothing dangerous about moderate exercise. As a matter of fact, the truth is the recommendation is maybe we should screen people if they want to do intense exercise, but even that, most exercise physiologists and most people in sports medicine think we probably don't need to do that either. That somebody who wants, even if they have diabetes and heart problems, that, you know, building into a program of intense exercise, they probably don't need a test to do that. Now, we always want to go gradually. Of course, that's sort of the key, but there isn't. So I think if you have an orthopedic issue, you know, the question is, what is the issue and what, you know, how can I, number one, how can I work around it when I have it? How can I
work around it, right?
I think a lot of the people that I see have to have an understanding of when is it okay to have some pain, when it's not okay to have pain. Because there's some conditions where we say, listen, you don't have to be pain-free to exercise with this. But here are the parameters on your pain so that you can keep exercising while we're treating you. Or, look, my knee arthritis is so bad I can't walk. Okay, what's our decision tree? And in that case, therapeutic exercise helps sometimes. So strengthening helps and walking helps. But we have obviously tools like injections, sometimes medications, or even, look, I have people that we replace, you know, they can't hike anymore, they can't ski anymore, they can't play tennis anymore, so we get them a new knee. Why? So they can go back to doing the stuff that they want to be doing. So I would encourage somebody who feels like, boy, I've got a barrier because of some pain. You know, make sure they come see you or me or somebody who can help them. But if you just say, look, I've got, you know, whatever condition it is, it's okay to exercise.
You know, I like to talk about my mom. She's had both her hips replaced by a friend of ours, and the first time she did it was great, and the second time she's a little hesitant to do it just because she's out of commission for a couple weeks. And anyway, my buddy calls me up and says, "Hey, your mom canceled her surgery." And I said, "Really?" So I call her up and I asked her about it, and she says, "Oh, my hip's not bothering me anymore." And I said, "Well, that's great, Mom." I said, "How was your walk today?" She goes, "Oh, I can't walk because my hip hurts if I walk." And that's the whole idea. I understand how she doesn't want to take the time to get surgery, and it's an expense, and people just don't want to jump at it. But I find that so often people wait too long on those issues. Once she got that, I rescheduled the surgery for her, and once she got that hip done, and she's been active for the last 15 years.
Yeah. And we certainly don't do surgery. Like, I have a lot of people say, hey, I want to be able to run again. And you say, well, listen, maybe we need to find a different activity, a better goal and a different activity and those sort of things. But, in the end, look, we don't want to do surgery or even injections and things unless we have to. On the other hand, we have tools to help people be active, which, again, overall then becomes the most important thing they can do for their health.
Right. As I was mentioning before, I have this great opportunity to learn from my patients. And I'm blessed with a number of patients in my practice who are over 80. I have over 50 90-year-olds and a couple people approaching 100. And these are very, very active people. And, you sit around at your office, you think to yourself, I want to be like that person who's 96 years old, still driving, still walks every day. And so I ask them, or I just kind of listen to them and I watch them. And all these people, they're active. They may not be exercisers per se, but these folks are active. And that's why it's so important, I think, sometimes to utilize the medical professionals to get yourself back to activity, particularly with joint replacement, because these folks get back to active.
Yeah, and I think you bring up a great point. I mean, it's hard now, even at my age, to project out, but I know that if I can even exercise now, even at the lower degree that I do it overall, it's going to help me have a chance at 80 of being able to be on the golf course and swinging a golf club and playing, or hopefully playing with my grandkids or skiing or doing those sort of things. Whereas if I just kind of let it slowly drift away, it doesn't mean I couldn't be okay, but it's going to decrease the chances. And I think the other thing is, we talked about this again a little bit earlier, is I know when I exercise that, okay, I could stand to lose a few pounds, I could stand to do this and that. If I exercise, almost all the health benefits that were going to be taken away by me not behaving myself, as it were.
Right. I can't believe that, Matt.
I get back by exercise. Now, it doesn't mean I should just say, I can do whatever I want, but there's a balance there, because life's busy, and there's going to be times in our lives where we eat better, where we sleep better, and all those things. But if we can make exercise the consistent thing, it really balances out all those other things that come into our life that may affect our health. So,
my son has gotten me very interested in the whole idea of like yoga and Pilates and things like that. So what do you know about kind of, I don't want to call them necessarily alternative kind of things like that, but what can you tell us about like yoga in terms of its health benefits?
So you take like Tai Chi, yoga, Pilates, and those things. Perfect. They have multiple benefits. Certainly balance is one of them. So we know older individuals have much less rate of falls if they do things like Tai Chi, modified yoga, modified Pilates. Pilates can build strength overall a little bit more, I think, than some of the other ones. But in the end, they tend to be good for flexibility, which is something we lose. We all get tighter as we get older. Right. I wouldn't say that, sometimes we talk about flexibility in the wrong way. You don't have to be the most flexible person to be healthy and to be active and to be an athlete. But certainly things like, again, yoga and those things are very good for keeping our sort of core, our posture muscles, all those things that sort of help us kind of move through the day. In the end, I think if you like to do that, then it's wonderful. Right? I hate yoga. It hurts me so bad. It hurts me so bad. So I choose...
My son is going to be very disappointed.
I choose not to do yoga, but I also find other ways. I think the other thing, that's a very meditative state in a lot of things when you do yoga, right? So I find other ways to sort of try to get those states, whether it's through certain different types of exercise or through other things. But no, I mean they've all shown wonderful health benefits. I think like anything, doing only one thing all the time probably isn't the best. So the more we can sort of change up, cross train. We even tell even our athletes we want to cross train. Professional athletes, we don't want them to. They spend all year smashing one way. We don't want them to do that when they have opportunities to do other things. So the same for us. So if we mix in strength training with some of the flexibility training and some of the cardio, you do that all together, and that just maximizes your ability to stay healthy.
Right. I was thinking about your point about doing something that you like, and I always talk about habits in my practice, and I tell people, you want to develop good habits. Unfortunately, I don't think people are as proactive about that as I'd like them to be. A lot of people just kind of, they do the things they like, and this is the things that they do. Those things that they like may not necessarily be great for them. Like watching football all weekend and not moving around kind of thing. And that's the great thing about exercise. There's such a variety of exercises that we can do. For instance, this winter, I've never been much of a treadmill guy. And my son was kind of getting after me to watch Game of Thrones with him. So I put up a TV in front of my treadmill, and I watched all 8 seasons of Game of Thrones, while sitting on the treadmill for an hour. And it was a great thing. I think there's so many things we can do in this day and age to exercise. What I was getting at with yoga is that meditative state, but there's also a lot of stretching involved.
Yep.
in yoga. So can you give me a couple minutes about the importance of stretching?
So I think stretching overall is a vehicle to keep joints mobile. Mm-hmm. I think that's where we sort of have to go with it. We have to sort of understand that there are different ways to stretch, whether it be yoga or stretch on your own. I'm not a big passive stretch guy. Meaning just the old school, just calisthenic stuff, lay on the field and kind of, I think active stretching, meaning taking joints through range of motion, and we do that a lot. That's a lot of the warm-ups you'll see athletes do now, where they're kind of moving and taking things through range of motion. Yoga is a sort of a combination where you're sort of turning the muscle on while you're holding a position and trying to get it. The only thing I would warn people about yoga, particularly as we get a little bit older, is we do see some people who have arthritis in their joints, particularly shoulders and hips. And one of the things that yoga tries to do is increase range of motion, which is a good thing. But if you have arthritis, it sometimes will aggravate that arthritis. Mm-hmm. So if you find yourself sort of getting uncomfortable, that's okay. If you find yourself having pain, that's not okay.
That's not okay. So let's say I've been laid off for a while, and I want to get back into a program. What's the first thought out of your head? Just walk, or what else?
I guess my first thought is, Peter, what do you like to do?
Well, that's good,
right? Yeah. Because I think in the end, you're going to stick with what you want. Or for me, and then we went back to I really enjoy golf. You and I play golf, and you can get some fitness walking the golf course. I mean, it may not be quite as good as running for a period of time. But for me, my motivation is I want to be able to keep up with the young guys in another 10 years. Right. So in order to do that, I got to be fit. And that's a motivation for me. So it's okay. Why? What's motivating me? Is there something that's motivating me that if I like to do it? So okay, I like to do this activity. How am I going to be able to do it for another 10 or 15 years or 20 years? But in the end, in the basics are walking is great. It is. Walking is great. You don't have to do anything more than walk if you don't find that.
Especially as we talked about earlier, if you're using hills, or because you're trying to get, you're trying to take the health benefits up by getting into that moderate level of exercise where you're a little bit uncomfortable. Talk to us about some of the gizmos we got out there these days, like heart rate monitors and things like that, and how people can put those to use. Yeah,
so even iPhones now, right? We were talking about the iPhone tracks you, which is a little scary, maybe scarier than it should be, but it'll track you. It'll track your steps. But I think it all depends on what some people are very motivated by saying, hey, look, I got in 15 or 20,000 steps today, and that's a motivating factor to kind of just be active every day. I think that's a wonderful thing.
I think it's all about motivation.
It's a great thing. The value of heart rate monitors, I think, particularly if you're training for something in terms of, okay, I want to know where my heart rate is because I'm training for a race and I'm trying to get faster, that's one thing. But I find a lot of people that maybe haven't really exercised before at a level where they've, not that they haven't been active at all, but maybe they didn't play sports, maybe they're not used to it, is sometimes you have to learn what uncomfortable is relative to the heart rate that we're at. So the strap heart rate monitors are a little better than the watch heart rate monitors.
And those strap ones are the ones you see on you can attach it to your treadmill?
Or they go to a watch, like you wear the watch, but the actual sensor goes across here.
I see, okay.
But they got the ones on the treadmill too where you can hold. Those aren't bad either. But in the end, I think it's very helpful sometimes for people, if they've never done that, to have an understanding of, okay, Dr. Gammons wants me to exercise at 130 beats per minute. This is what that feels like.
And in general, Matt, it's about your age, 220 minus your age is approximately.
It's approximate. I mean, there's a lot of genetic variation in that, but to get some sense of where you should be. But if what you'll find with people is that Peter hasn't exercised really ever, I say, I want you to be at 1.
Hey, that's a secret.
Yeah, I want you to be at 130. And you'll be pretty uncomfortable at 110. And you think you're really working hard enough. But you got to learn that, okay, I got to get a little further beyond that to get the health benefit that I'm looking for. And it doesn't necessarily have to happen that day. I mean, again, you build into that and you adjust to that. That discomfort will, you'll push your limits to where, okay, I was feeling uncomfortable at 110. Now I feel uncomfortable at 130. So it's, it's not something that we say we flog you with a whip until you get there day one. But I think it is important because sometimes people don't really understand how uncomfortable I should be. And we talked, I'm not a good sufferer anymore. I used to be a pretty good sufferer, meaning that I could push myself. So sometimes I use a heart rate monitor if I've taken some time off and I want to know where I am just so I get back to that, okay, this is the sensation I should have when I know that I'm pushing.
I'd like to thank Dr. Gammon today. That was a wonderful discussion. I really enjoyed that, Matt, and I learned a lot too as well. Thanks again for tuning in or listening. And again, if you have any ideas about future programs, just give me an email at peter@peterhogenkamp.com. And I really appreciate your tuning in. Ciao.